Good afternoon, everybody. Welcome to our second town hall of the week. Thank you for joining us. We have some exciting updates for you today. And so we will go ahead and get started because we've asked for just an hour of your time and we want to make sure that we are good stewards of that. So today we'll do just a quick introduction of the teams that you might hear from. And then also, if you're open to it, please go ahead and use the chat and share with us who you are and where you're from and what your role is. You can just use your first name. That would be excellent. And so go ahead and put that in the chat. So as far as introductions of the Department of Human Services team and then also our partners at Alvarez and Marsal, I'll go ahead and start and then turn it over to Carrie. My name is Joey Uni. I am the director of the Division of Developmental Disabilities. And you'll also be hearing from Carrie today.
Hi, everyone. Happy Friday. My name is Carrie Geppert, and I work for the Division of Developmental Disabilities as the Family Advocacy Coordinator. I'm also a parent of a child with a disability.
Thanks, Carrie. And then we'll turn it over to the A&M team who might be helping us throughout the conversation today as well.
Hey everyone, I'm Erin Leviton. I lead our team here at A&M working with the department. Turn it to you, Shivani.
Hi everyone, I'm Shivani Patel. I am the lead on our work with South Dakota and happy to be here.
Thank you. So today, again, we're going to share some updates about Agency with Choice and our search for a new provider. We're also going to share how you can learn more and how you can also partner with us if you're interested in that. And then, of course, we want to hear any questions or ideas that you might have. Our goal remains the same since we first started hosting the town halls, which is to minimize disruption for people with intellectual and developmental disabilities and their families. Again, with the goal of providing a stable and reliable service system that meets people's assessed needs. And so with that, we will move forward onto the next slide. So we would love to hear any questions that you might have. So if you have a smartphone, you can hover over that QR code and it'll take you right to menti.com. If not, you can go right to menti.com and use the code there, which is 2748-9664. And go ahead and ask away. Ask any questions that you have. Please let us know if there's anything that you think we should know at the Department of Human Services.
Are we supposed to do that right now?
Yeah, you sure can. That would be great. It's going to stay open. You can do that throughout the meeting, and then towards the end, we'll review the questions that come up or the feedback. So we'll keep moving on, and this again will be open for you to ask questions or put feedback into the Menti poll throughout the meeting as well. So we'll start with what is changing with Agency with Choice. And so again, people who are receiving Family Support 360 use a model of self-direction that is called Agency with Choice. How those services are occurring now is changing. And so if you're wondering if this applies to you, it does if you are enrolled in the Family Support 360 waiver and receiving services from LifeQuest, Dakota Milestones, Volunteers of America, Lifescape, or Center for Independence. And the services that this specifically relates to is personal care, respite, companion care, and supported employment. So all the other services that you are receiving as part of being involved with the Family Support 360 waiver, those aren't changing. They're not impacted by this Agency with Choice change. So of those 5 providers who currently offer Agency with Choice services, they've notified the Department of Human Services that they will stop providing those services. And so right now, again, those services are essentially co-employer services. So those are the only services that are impacted by the change. And since we were provided that notification by the community support providers, we have started at the state level to explore ways to sustain agency with choice in South Dakota. And through this process, we've been sharing information as we've had it. We've done that through other town halls. We've done that through emails. We meet weekly with family support coordinators. And so we've been sharing information throughout as we have it. So we do know of those 5 agencies. We know when they've said they'll stop providing the service. And so the first one to stop is LifeQuest, and they are ending their service on August 31st. Dakota Milestones, Volunteers of America, and Lifescape are ending theirs in December of 2024. And then Center for Independence has 2 different stop times. December of 2024 for a handful of their current employees, and then May of 2025 for the remainder of those employees. And so this is the information we know about what's happening with agency with choice, and why all the communication that we've been sharing about getting a solution going forward. So we've shared this before, but it's certainly worth keeping on the forefront, wondering why it's taking so long. So to find a solution really requires multiple steps. It's a complex process to go through. And so we really laid out what those steps entail. And so I think the last time we met, we had just those top 3 completed. And now we're at the point of having those 3 kind of at the center that are highlighted. Those are also completed. And so I'm very happy to share that the Department of Human Services has narrowed down a potential new vendor. And so as part of that, we've identified a national vendor with expertise in agency with choice, and we are in contract negotiations with them. So it's early. We don't have a lot of information to share, but we have this great news to pass along, which I'm very excited about. And again, a commitment that as soon as we have more information, we'll also be passing that information along to families. So we've identified a potential new vendor. As part of that, we've updated the rate structure for agency with choice. And because we updated the rate structure, we also had to look at budget requirements. And so we've been able to complete those 3 items since we last spoke to you all in our previous town hall. The next 3 green bullet points are the things that we're currently working on. So we're working to make changes to the agency with choice model. Specifically, we are working to ensure that we eliminate any 20-hour per week cap that is currently in place. And so if you or your family are experiencing the part-time worker requirement, we're working with the potential new vendor to ensure that that's not a barrier that families would face potentially going forward. We're also developing contract terms, and we are working to get that contract signed because that's the next key step to be able to share more information. That contract has to be signed first. And then we're also working to update the waiver. So if you joined us last time, you probably heard me share about the waiver having a really prescribed process. And that's because the waiver comes from the Centers for Medicare and Medicaid Services, and their requirements are very prescribed, which means they say kind of what has to occur and when it has to happen. And so as part of updating the waiver, you all will receive from us a notice that there are drafted waiver amendment. There is going to be a public comment period that lasts 30 days. And then we will submit that to the Centers for Medicare and Medicaid Services for their review and approval. We then will move to the 2 bottom bullet points that are not yet started. So once we submit that to Medicaid, or I'm sorry, the Centers for Medicare and Medicaid Services, they'll review. And if they approve, we'll get that formal approval of the waiver amendment and the funding for that. And then we can begin signing up providers. So that's kind of the timeline that we're on. Again, We've made great progress, and again, so excited to be able to share that we've got this potential solution identified, but we do still have work ahead of us. So we have received feedback throughout this process, which we greatly appreciate. We've been using your feedback as we work towards a solution. And so right now we're at step one. That's where we are today, working to find a stable and sustainable solution for agency with choice. We've appreciated your feedback on what's working and what's not working, and we've taken that into consideration as we're looking for solutions. We have continued town halls to share information as we've had it. We're planning for a listening tour, and that's specifically to learn more from you all about your experiences and ideas that you might have. Next week, we're launching a family work group, and that's specifically around self-direction. And so that work group's going to help us plan for the implementation of these early changes. And then, of course, there will be an opportunity for you all to share your feedback on the waiver amendment when that goes to public comment soon as well. So that's kind of where we are right now in this point in time. Step two then is the long-term goal and kind of where we're going next. And so at that point, we'll be working with families to really modernize and transform agency with choice. So as part of that, how you'll see us partnering with you will be continuing the town halls. We'll have a listening tour to hear about your experiences with the new vendor. We'll work to reset and reopen that family work group to new members, because again, we know that those agency with choice providers now are ending their contracts at different times. So there will be folks impacted at different times throughout this change. And so by us reopening the family work group, it allows new people that are currently going through a transition to actively provide feedback on that directly to us at the Department of Human Services. There will also be another waiver amendment at that time. And so you'll get another opportunity to share your feedback at that time. And then, of course, I think many of you have probably engaged with us through emails, the surveys that were done, but we would love to know if there's other ways that you would like to hear from us, or other ways that you would like to give us feedback. And so, surveys is an example, but you can let us know in the chat. If you're comfortable, you can take yourself off mute as well. If there's other ways or other ideas that you have for how you'd like to engage with the Department of Human Services in the self-direction conversation. So I'd mentioned the family work group. We are kicking off the meeting next Wednesday, May 22nd. It's crazy to think it's already towards the end of May, but we're going to be meeting in the evening on the 22nd. And again, this work group right now is partnering on self-direction. We have a great group that's self-selected that we're very excited to partner with. There's people that I don't know, and I'm so excited to get to meet with them and to partner in this way. Again, the first meeting is going to be next week on the 22nd. We're going to meet for about an hour, and it's going to be a virtual meeting. After that, any ideas that come from the work group or other feedback that comes from the work group, we plan to share that here in future town hall meetings as well. So you'll definitely hear more about this work group when you join us in future conversations. So I talked a little bit about the waiver amendment public comment process. And so again, there is the requirement to publish the notice, and that's really your, I kind of think of that as like a heads up. There's a change happening. This is kind of what's proposed about those changes. And then the next step there, number 2, is that 30-day comment period. And that's the opportunity to have you share feedback on those proposed changes. And then the third step is the state then takes all of the responses that were received during that public comment period, summarizes them, and then responds to the comments in the waiver. And those all get submitted to the Centers for Medicare and Medicaid Services as part of that process. And so as part of the public comment process, we do want to hear from you. So it'll be an opportunity for you to share any comments that you have around the waiver, and you'll hear from us because we'll be sharing the draft and the notice through email. It's also going to be posted on our website. And then we're going to be hosting a public comment forum, which is something we're doing outside of the requirements for that typical process. And that's going to give us an opportunity to hear more information and more feedback and to take public comment live. So again, more to come on that. We'll be communicating that as soon as we have an update and the notice is clarified. There's also other ways to get additional information from us. And so please check out the Agency with Choice website, which can be found on the Department of Human Services Division of Developmental Disabilities page. There's also an opportunity, if you haven't yet, to sign up for our Family Support 360 listserv. And then if you have any questions at all about what's happening with Agency with Choice, how can you get involved? If you have feedback that you want to send to us, you can use the email ddd.update@state.sd.us to get any of that information directly to us. I didn't see, did we put the links in the chat? Yes. Thank you, guys. So if you want to pull the links, you can do that and then reach out to us through the email. If you want to join the listserv, that's a link to do that. And then that Agency with Choice website is really the place where the most up-to-date information on what's changing with Agency with Choice can be found. There's a lot of good training resources and other information there as well. And if you have a family support coordinator, they are well aware and are a good resource to help you navigate that as well over to the website. So again, another opportunity. What questions do you have? I just shared a lot of information. So please, I would love to hear from you. You can use the chat if you have questions or use the Menti poll. And I will pause so that we can take any questions that you all might have. Okay, so I see a question from Nikki. What supports will be provided for families if their vendor ends before the new contract is signed with the new vendor? That is a great question, Nikki. And so we are working really hard to ensure the least amount of disruption to people. And so we, as part of that, we're working hard to get the contract signed and in place prior to so the first contract ending is LifeQuest on August 31st. So we're really working hard to get that in place to ensure as smooth as possible that transition for families. And then Karen asked, could this be in place by 8/31 for those of us that are with LifeQuest? Absolutely, that is our goal. We're doing everything we can. We will provide updates as soon as we have them. But our goal is to have the contract with the new vendor in place prior to August 31st of 2024. What other questions do you have? And if you don't have a question, I'll happily take any feedback as well. Okay, I see something from Nikki. With school being out, families are looking for new respite care providers. There is some guidance being given that new respite care providers cannot be secured. Is this accurate? Nikki, I'm not sure if I understand your question about what do you mean by secured?
So we have families that have given us information that they're being told that they can't hire any new respite care providers for the summer to support with like community access or like learning how to ride the city bus, some of those things. That's what at least we're being told through the school district, is that families are being given guidance that they should not be hiring new respite care providers, or that they are unable to hire new respite care providers for the summer.
Do you know where this information is coming from?
Family
I'll
support,
I'll
family support, family support 360 providers.
Okay, thank you. I'm gonna put my email directly in the chat as well. So if there is any, we want to make sure that we're not talking about anything too personal, like there's a personal situation, Nikki, or anybody else. I'm gonna put my email in the chat so you can follow up directly with me. But the other clarifying question is, the examples of activities that you had shared, do you mean companion care as well?
Yes, I'm sorry,
Okay.
companion care.
Okay, I just wanted to
Sorry.
make sure I understand the question.
Yep, sorry.
So let me see, we might have some providers on the call. Is there anybody from the provider system that might be able to clarify if this direction is accurate?
Hi, this is Amy from Lifescape. And for us, we have been adding new providers for existing families only when or if we have any open spots. But all of our spots are full right now, so we can't take on any new ones for agency with choice providers. So that would be the update from Lifescape.
Thanks, Amy, that's helpful. Any other providers that want to help to clarify that question?
Hi, this is Angie Barsh, Family Support with the Volunteers of America. So I think what Nikki is saying is like some of the agencies with choice are not taking new applications at this time. LifeQuest did open up their application process again through August. So I have signed a couple of people up for companion care and personal care just in the last couple weeks.
Okay, Emma.
Thanks, Angie, that's helpful.
Hi, this is Kate Miller from LifeQuest. And just to clarify, we are currently taking new provider packets, but only through Monday. And we will continue to process them through the end of this month, but all materials have to be in. So we're not taking new providers all the way to August 31st. We're only taking them until essentially Monday. So if you're looking for providers, get those packets mailed in ASAP or emailed or however you get them to Jean.
Thanks, Kate. I appreciate
You're
sharing
welcome.
that additional information.
Yep.
I just wanted to say real quick too, that the common law option is still available for families. And I know Joey's going to talk a little bit about that too, but if a family member wants to have companion care or respite care over the summer and they're not able to do it through their current agency with choice model, common law is an option for that support to be accessed right away. So just keep that in mind. If you're visiting with families, there is an option for them to receive that support still.
Thanks, Carrie. Yeah, and just to add on to that again, your family support coordinator is a great resource for you. They're very knowledgeable and they'll be able to help navigate through that if that's something that you're looking for or to learn more about. We also have office hours and Carrie leads those and we can make sure that those get put in here. She's going to talk about it in a minute. So but again, make sure that you talk with your family support coordinator. They're a great resource for you. We have been meeting with them weekly around the changes with agency with choice. And they are well suited to be able to help navigate any questions that you all might have as well. We're happy to take them. And again, we have other avenues for you to ask those questions to us because we do want to hear from you as well. What other questions do you have? Well, hearing none, Carrie, I'll just toss it over to you then.
Sounds good. Thanks, Joey. And thanks for that exciting news that we're in contract negotiations. That's really exciting for families. So, oh, yep. I guess
Okay.
Yeah, Joey's going to
sorry.
do this one. Yeah, then we'll get to
So again, there's other opportunities for you to give us feedback. So we're looking for feedback for anybody who is open to sharing it around the front door, how you have access services since June or prior. We are working to take that feedback and make our processes better. And so again, you can use the email ddd.update@state.sd.us if you have information to share about your experience regarding, completing an application or getting connected with services. We would love to hear that feedback. We're also looking for volunteers to test what's called the participant portal. This is a portal where people who are applying for services are going to be able to access the actual system, enter application information, upload documents. We've been working with a group for some time around the intake process. And so we're at the point now where we are able to start testing the actual technology system so that people can provide us feedback on, does it make sense or what works and what doesn't work about that process. And so if you are interested, if that all sounds like something you would love to be a part of, we want to hear from you. So again, sending that to ddd.update@state.sd.us if you're interested in volunteering to help us test that portal. We would love to hear from you as well. Now I'll turn it over to Carrie.
All right, thank you. Lots of opportunities for families to get involved, right? That's exciting that we have such a great partnership with our Division of Developmental Disabilities to really provide direct feedback into what families' experiences are. So our Division of Developmental Disabilities is in partnership with some community partners that is called the Supporting Families Community of Practice. And what a community of practice is just a big fancy word for a gathering of people to come together in a learning environment to identify needs and of support for families in South Dakota and to come up with creative solutions and ways to meet those needs. And so we've been involved since 2016, I believe, as a partnership with our community members, some of our providers, family members, self-advocates, So we have a lot of different community partners that are already serving families in their communities. And so this is an opportunity for all of us to get into one space, share a meal together, and really just talk about what are the needs of families currently, what are we seeing, what's trending, and then what in an integrated approach to finding out what resources already exist, or maybe some resources don't currently exist that need to be created. And so it's an opportunity for not just the DDD system, but for our community system to come together and really create solutions to meet those families' needs. And so you are all invited to participate in one way or another, either in person or virtually, to just be that voice and just share your own personal experiences, and then also come with like creative solutions, or if something doesn't exist, what would you like to see exist? So there's a virtual option next week, May 21st. We're gonna just meet via Zoom, so you can bring your supper to the Zoom link, and we'll be meeting from 6:30 to 8, and that's Central Time. So our Mountain Time friends can also join us at 5:30 to 7. We do have an in-person in Aberdeen, June 6th, from 5:30 to 7:30 at the American. And then in Sturgis, we're going out West River and we're going to hang out together. And so we'd love for our West River friends to come along and have supper with us, and have a meeting of the minds of what can we be doing differently to support families in South Dakota. And so that's June 12th from 5:30 to 7:30, and that's Mountain Time. And then our next slide is talking a little bit about common law. I mentioned that earlier. Common law is a newer model that South Dakota is offering to provide those self-directed services, right? And so I hope that you've had an opportunity to attend previous meetings specific to common law. But if you're not familiar with common law, this is a great opportunity for you to learn more. So we're offering office hours every Monday from 4 to 6 p.m. and that is Central Time. And then every Wednesday from 12 to 2. And it's just a Zoom link. You don't have to pre-register. You can just hop on that link and we can share more about what common law is. I'll tell you my own personal story because I have a 17-year-old daughter that heavily uses companion care, especially in the summertime. And it's a great option for my family because we really need sometimes over that 20-hour a week, and we don't have multiple providers. And so common law has really kind of eliminated that barrier for my family. And so I can just share with you a little bit about my experience of going through the paperwork and how to fill it out and how long the process takes. And so I can share my personal story and certainly get you connected to other families that have had recent experiences, or some of our families have been on using the common law method for a little while now, since back in November, December. So they've got a little bit more lived experience than I do, but happy to share that information. And then another option for families, for those that have loved ones that are over the age of 21, shared living is a really great option for some families. And so it's just an opportunity for you as family members to make informed decisions about how best to support your family. Every family has unique needs, and what I need for support might look very different than what you need for support. And so let's just get together and visit during one of those office hour times. And we can just talk more about what your unique needs are and maybe which options would work well for you. Again, this is not to replace the great work that our you and engaging you with, but this is not really so we hope that you like.
Sorry, Carrie, I think there might have been some connection issue.
Oh, yep. I think I just ended it with, I hope that you all can join us and let's have a visit next week during common law office hours.
Thanks, Carrie. Any questions for Carrie around community of practice or the office hours? Okay, I'm not hearing any, so we are back to more of the open forum because we really do want to hear your feedback. So if you have questions for us, you can do the Menti poll and ask those anonymously, or you can use the chat, or you can take yourself off mute and ask ask any questions that you have. If you have comments or other feedback, we're happy to hear those and take those as well. So I would say the biggest update, right, is that we've made some progress since we last met. We've narrowed down all of the work that we were doing to identify a new vendor. So we've narrowed that down and we're in contract negotiations. As soon as that contract gets signed, we'll be able to share more information with you. But we are very excited to have this update. There's been a lot of work and many of you have helped us with that to get here to be able to share the update that we have a potential solution identified and that we're moving towards that goal to be able to have that secured by the end of the first agency with choice contract, which is August 31st. We've also sent out some communication to families, so maybe you all received that. And again, we're meeting weekly with your coordinators, and they're a great group of people, and we are working with them closely to make sure they have all the information to be able to help you navigate through the changes as well. So what questions do you have? Comments?
Can you hear me?
Yes.
Okay, sorry. I'm a little late to the game probably. We've known about some of the Zoom meetings, but haven't taken advantage of those. I'm in Rapid City, but the agency of choice that you're looking at, is that the one out of Arizona? I've been filling out these long packets of employer and employee packets and found them extremely confusing, but trying to work my way through it anyway. Is that the agency or is there a different one? Do I need to submit those
So
soon?
Roy, it sounds like you might be referring to common law.
Oh,
Have
okay.
your
Didn't know.
documents, it's okay. Have your documents been for an agency called Acumen?
I believe so.
Yes. And so that is for a different model of self-direction.
Okay.
That's the model that Carrie had mentioned,
Okay.
is always an option outside of the changes that are happening with agency with choice. That remains a stable option as well for families, especially right now, as Carrie had shared, you know, her personal experiences requiring more than that part-time or 20-hour. And so for some families, that's an option for them to explore now.
Okay, gotcha.
And so
Yep.
I think that might be what you're referring to.
Yeah, I just may not have known the terminology. Unfortunately,
Yeah.
you know, we're not in that place where we need an extended care. Our daughter's 17, and I'm retired and so forth. So, but we do have the need for, you know, on an occasion, or maybe more so in the future of respite care. But so you're talking, this is talking about what you're talking about, the agency of care is something, another program that I would talk to our advocate about.
Yes. Yep. So
Okay.
if you, do you, prior to completing the paperwork that you had, if you were affiliated with a different provider, LifeQuest,
Right.
CFI, that's a service that they're ending that we're working
Right.
to replace.
Okay,
So
gotcha.
that service can still be offered in South Dakota as part of family support. Yeah.
Good. And I should probably take advantage of the meeting she just talked about on Mondays or
And
Wednesdays.
Carrie's a great resource, Roy, as well.
Okay, great.
And I just gotta tell you, Roy, that paperwork, I had to, we'll talk about it, but yeah, so it's the real deal, right? But that's why it's awesome that we have an opportunity to connect and make sure that we get it filled out correctly. And the great news is once it's submitted, It's actually really easy after that.
Now
The
that's
paperwork
good.
might be the hardest part.
Well, that's good to know. So I haven't submitted it yet. I'm still making sure I have all my T's crossed, I's dotted, etc.
Yeah, let's get together next week.
Okay, thank you.
Thanks, Roy. Other questions or comments? Shivani, are we seeing anything in the Menti poll?
Nothing yet, Joey.
Okay. I mean, it is an exciting update, so maybe there's not a lot of other questions, but we sure would love to hear, again, any questions that you might have, any feedback, general comments. We're right on the cusp of summer. You know, there's a lot of things happening, so we will stand by. We have several minutes yet before our time that we had asked for it will end, so. Okay, I'm actually seeing a question now in the chat. In last month's town hall, you mentioned that the waiver needed to be updated in a process that would take past the end of August. Does that not need to be done before you start with the new agency with choice provider? That's a great question, Michelle. So we are working hard to ensure, again, the smoothest transition as possible. CMS has a standard time frame for review, which is 90 days. And so from the time we submit, it's 90 days. It could take less time and it could take more time. So we are working to get that done. So again, that we can ensure as seamless transition as possible. So more to come on that as soon as we have more information. A question in the chat says, how many different programs are there going to be? LifeQuest will be done, so are there 3 different programs now? So right now, the current agency with choice providers there are 5. LifeQuest, Center for Independence, Volunteers of America, Lifescape, and Dakota Milestones. And so those contracts are all ending at different times, with LifeQuest being the first to end August 31st. So right now we still have those 5 providers. And again, we are working on a contract with a new identified provider that will help us ensure that agency with choice services continue in South Dakota. So right now there are 5 agency with choice providers. When LifeQuest ends in August, then there will be the 4 existing. And if the contract is signed with the potential new vendor we've identified, we'd be back up to 5 for a period of time until December, when the additional contracts end. Any other questions? Okay, so then an additional question is, with LifeQuest, is common law my next option that will not expire? So common law is still the best option to ensure there is no disruption at all. There's also, as Carrie had shared, there's not a limit on part-time workers. And so many families are finding out that that's a good fit for them. So Melissa, I would say that's definitely something that you should explore with your family support coordinator to make sure that you have all the information to make the right decision for you and your family. Any other questions? So Melissa further asks, so that is going to be Acumen. So right now, the common law provider is Acumen. That is the only provider that we have that offers the common law model of self-direction, which is different than the co-employer with agency with choice. So yes, the only common law provider is Acumen.
Melissa, I would just say too, there's a really great side-by-side resource on the Agency with Choice website. And I think that they had dropped that in the chat box of where you can find that website. But there is a great description of like common law, what that looks like, and versus like what you're currently accessing, which is Agency with Choice. It's just for families, I think it's really helpful to see it side by side of like what's different. And so that's a great resource on that Agency with Choice website.
What else? Other thoughts, questions? If you're thinking it, somebody else is probably thinking it, so don't hesitate to ask. So I'm fairly comfortable with long silences, so I'm willing to stay on. If you've got to run or you feel like you got the information that you needed from today, that is fantastic. Please don't feel like you have to stay on. We asked for 12 more minutes. I will stay on, but if you do not want to, you certainly do not have to. I'll stay on, and I know others will as well to help answer any questions that might come in. And so just so you know, no pressure if maybe you're not as comfortable with silence. And I see Melissa has a question about, so Acumen is just the administrator for the funds. So Acumen will help the family with the employee paperwork, as well as the payment for the employee who provides the service. Carrie, anything you would add based on your experience with Acumen?
Yeah, similar to what our experience with Agency with Choice has been, right? So all the things, for the most part, all the things are the same as far as like how they receive their paychecks. It's direct deposited. Acumen actually has an app that your employer or employee and employer can use to approve time cards. So your employee will submit their time, through the app on their mobile phone, and then the employer can just review that on their mobile phone and approve those services. There is a little bit more responsibility on the employer, which is the family member or whoever is selected to be the employer. So that's different. But as far as like, sending out W-2s for your employee, making sure that they get paid, having, their time cards and stuff approved, all of that stuff is very similar to Agency with Choice, because we still had to go in, to the focus system and make sure we approve their hours. And then the biggest difference is that you don't have your family support coordinator kind of keeps track of a lot of that stuff. And there's a little bit of a shift of responsibility onto the employer. In my case, I'm the employer, and then my employees are my providers, right? So my daughter provides companion care and respite care. So my daughter is my employee and I am the employer. So the biggest difference is that there's a little bit more responsibility on the employer. But all the other things really are very similar as far as implementation of how they get their tax forms, and Acumen actually does all of that work.
Thanks, Carrie. These are great questions. We appreciate them. Shivani, are we seeing anything in Menti? No? Okay. Again, we will just hang on the line for any questions that you might have. So a question came in. So I understand this common law can be more than 20 hours, whereas LifeQuest was only 20 hours. That's correct, Melissa. There is no limit or requirement for staff to only be part-time at that 20 hours in the common law option. And that's another piece that we're working as well for families to ensure that our solution has a remedy for that as well. Again, we're going to hang on the line. I know some of you might have to drop off. We have about 6 minutes before we're at our requested time with you today. So we'll hang on the line, no pressure. Want to make sure that if you have a question that you have an opportunity to ask it. But if you need to drop off, thank you so much for joining us today. We will share additional updates as we have them. And there will also be additional opportunities as we shared today for town halls, those folks that have volunteered to assist with the work group, that's going to be kicking off. The emails, as soon as we have information, we will be working to get that communication to you. As always, your family support coordinators are a great resource for you. And you can always reach us anytime at ddd.update@state.sd.us as well. And again, thank you so much for joining us. We'll hang on the line for additional questions, but if you have to drop, we understand as well. Thank you. Shivani, no Menti poll? Okay,
I double and triple checked that it was the right code we used.
okay. Well, that's a good sign. Hopefully,
Yeah.
it means that our communication was clear. Lots of other good